the world develops, there is a lot of variation in the population and medical capabilities. This leads to different epidemiological stages. Here we will talk about the second to fourth, along with the possible fifth stage. DTM epidemiological stage 2 is characterized by high birth rates, high infant mortality rates, and a lower life expectancy. Most deaths tend to be caused by infectious diseases rather than cancer or heart attacks. The country being reported on today is Nigeria. Nigeria has high birth rates, however, most babies die due to a poor healthcare system. Life expectancy also tends to be lower due to a poor healthcare system. Infectious diseases are common throughout the population and are the main causes of death in Nigeria. Healthcare in Nigeria is not very good, with there being less than 5 physicians per 1,000 people and fewer than 10 hospital beds per 1,000 people. The government spends below $100 per capita on healthcare related expenses. Combined with that, 70% of the population is below the poverty line and about 8.4 million people are food insecure. Nigeria has been hit hard with AIDS, with 1.4% of the population being infected. Combined with a poor healthcare system, Nigerians do not have much protection against AIDS. Nigeria would be considered overpopulated due to not having enough food to go around, since 8.4 million people are food insecure. This would fall under the Malthusian standpoint, since he says that food will grow arithmetically and population will grow geometrically. This results in people going hungry. On to stage 3.
Stage 3 of the epidemiological transition includes characteristics of less deaths by pandemics and epidemics and more deaths by chronic cardiovascular and degenerative diseases that are associated with aging. Significant examples of these are heart attacks and various forms of cancer. Global patterns of these diseases are opposite of that in stage 2, since the life expectancy in stage 3 is raised to above 50 years, and when you're older, you're more exposed to getting these cardiovascular and degenerative diseases such as heart attacks and cancers. China is the example chosen for this stage, and at this time, China is in stage 3 of the DTM as well, which means the CBR is declining rapidly, the CDR is moderately declining, and the NR is moderate or low. More of the women are educated and in the workforce, and this results in knowledge of family planning and more use of contraceptives. The population pyramid in this stage will have a wider base, but it will start to shrink more towards the middle, and the top of the pyramid will begin to grow wider. China transitioned to this stage due to medical advancements and increase in women's status in education. There are 6.46 hospital beds per 1,000 people in China and 2.36 physicians per 1,000 people. AIDS in China isn't that much of a concern, with less than 0.04% of the population being infected, and that matches up with the characteristics of stage 3. The Boswell theory is applied because even though the population is massive, China's agriculture is also increasing along with the population to the point where the population can be supported by the amount of food that they produce.
The US is an example of epidemiological stage 4 country. The characteristics include a decreasingly low CBR, low but slightly increasing CDR, and a negative NIR. With ample food and agriculture, people exercise more, have healthier diets, and the life expectancy extended due to medical advancement. Almost everyone has access to some sort of healthcare. But people are now dying either because of cancer and other self-generated diseases or from illegal drugs and prescriptions. Men and women have nearly, if not equal rights, and work side by side. Women in this stage have birth control, education, and contraceptives, which improves family planning and lower MIR. Many stage 4 countries have a cornucopian viewpoint, which states, as technology advances, so do the resources the human population can use, which essentially states that overpopulation isn't too much of a problem as long as the world develops. The US has a large healthcare system, but surprisingly only has 2.87 hospital beds and 2.5 doctors per 1,000 people. The US currently suffers from a COVID-19 pandemic, which threw the USA off as they don't have as much hospital beds. But with only 11.4% of the population living in poverty, COVID-19 has only severely impacted those areas. The population of the US has a small amount of old people and a decent amount of children. compared to the massive amount of workforce because lots of immigrants. Therefore, the population pyramid looks like a column or an ice cream cone.
Finally, the possible stage 5 of the epidemiological transition could soon include countries such as Russia. This stage is characterized by the reemergence of infectious diseases which are now more resistant to medicine and can rapidly spread through populations due to the high level of interconnectedness. Russia suffers from some diseases such as tuberculosis, tick-borne encephalitis, and rabies. These parasitic and infectious diseases are amplified by having an aging population, which is a characteristic of a stage 5 DTM country. Russia has large amounts of healthcare, with 4.4 physicians and 9.1 hospital beds per 1,000 people. It also has public healthcare, although 21% of its population uses private healthcare. The infectious diseases especially spread fast in impoverished areas. COVID-19 is an example of an infectious disease that has high resistance and severely impacted the elderly population of Russia. These strengthened diseases are a concern for the future, as they will only get stronger and the world is getting increasingly connected, with many impoverished countries whose populations will get severely impacted.